And the good thing about all of this that we're going to recommend is you can use it for other things. Like if you get a random bruise or bump into something,
helpful.
You can use it for anything.
Yeah.
So the first thing. Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. And today we are wrapping up our series on what to buy for your various procedures. I've got Dr. Amalfi here, and we are going to talk about fillers and what you should have on hand in case you need it. Yeah. This is going to be a quick and easy one, but fillers are so common in our practices that it's good to have stuff on hand.
You're going to have fillers more than once because you're going to love it. And you're going to come back every year or 6 months or whatever. Yeah. So these are good things to have because you'll use them again, I promise. And it's always cool because my repeat filler patients are always prepared. They're like, oh, I took my arnica. I have blah, 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 blah.
Yeah.
So you'll be ready to go. But we're going to tell you how to be a pro your first time.
Yes. Exactly. Well, and the good thing about all of this that we're going to recommend is you can use it for other things. Like if you get a random bruise or bump into something, helpful. You can use it for anything. So the first thing is arnica.
Arnica, yeah. I mean, do you do oral arnica or topical or?
So both actually. So it really sort of depends on what the patients want. I definitely tell them to do topical, but if they are easy bruisers or, they are just bleeding more than they should be, or they take a lot of herbal supplements or whatever it is, then I just tell them to take the pill. Yeah.
Some people even start them ahead of time. I have a ton of patients who and it's just this little herbal supplement that you can get at the drugstore or the grocery store. It's super easy to find. It's called arnica. And you can take these little tablets under your tongue. So I have a lot of patients who will start them the day or two before their appointment. Just to start preventing bruising. And it really does help. And if you use it on a bruise and watch it go away, it works pretty well. It's really cool. And that's nice to have. So definitely arnica, gel, oral, whatever you want. Yeah. Is really great. You can even get lip gloss that has arnica in it. And we have, sometimes that we'll give to patients, but that will reduce bruising and swelling and just treat your lips after you've had lip injection. So that's a nice, super specific way to use it. And then what happens if you do get a bruise? What do you do?
Well, if you get a bruise, you need to conceal it. So make sure you have concealer at hand. If you're a guy, that's a good thing to have as well.
Yeah, just grab it. It's fine.
Yes. But while the arnica is working, it's always good to have a little concealer on hand to sort of hide those bruises, especially the lower eyelids, right?
You can cover a
tear
lot.
Troughs.
I have had a legit black eye from tear trough filler, and I just used a really thick BB cream, and I was able to totally cover it up. And then I just wore a thicker pair of glasses, and I had a total black eye and no one knew. So you can, don't plan filler before a big event, but you totally can cover it up if you get the right products.
Yes, exactly. And bruising is common. We're two surgeons, plastic surgeons, and we get bruised ourselves.
Yeah, so it doesn't mean it's good or bad, or
it doesn't mean it's good or bad. It's just there's a needle going through the skin, and so you're going to bruise. So it's better to be prepared. And then lastly, ice packs.
Yes, that's perfect. Yep. And just a little one is all you need, but ice feels so good. I'll ice for a really long time after filler because sometimes,
especially
if you just push
lips,
on, it's just sore. Yeah. And then that ice, it helps with some of the inflammation too, but it just feels good. And so there's no such thing as if, too much ice. Obviously, you need to take breaks, but, no matter how many days from injection you are, if it feels good, it's absolutely a good thing to do. So that's your best friend. Little cute ice packs. Yes.
Exactly. You can get all sorts of but that's it, guys. I think those are our three things for
kind of three things, right? And then you're ready.
Arnica,
and then you have
concealer, ice packs. Yeah, and then you're
ready
for
the next time. Start your arnica ahead of time for your next injection, and you're ready.
Yeah. All right. Well, that wraps up our series, right, Ash?
That was super fun. Yes. Maybe we should do a what to buy about something else, but this is what you need to buy for surgery.
Yes. All right. Well, it was good seeing you all this week. We'll see you next week. Lipstick and Lipo.
All right. See you guys.
Bye.